All right, so let's get through this lower extremity. Again, just like upper extremity, lower extremity anatomic review, or even the course itself goes 1, 2. So we'll do from the toes to the knee 1 week, and then knees through the pelvic girdle following week. So lower extremity 1 and 2. All right, let's start with the anatomy radiographically. We're going to do it the same way as we did the other one. Let's see. All right. The good news is if you learned how to do the hand, if you understood the anatomy of the upper extremity, the lower extremity mirrors it. They're not identical, but they are parallel. They are very, very similar. So the same mental structures you develop to memorize the upper extremity will serve you very, very well in organizing this information as well. All right, let's talk about it. We have phalanges, proximal, distal, proximal, middle, distal. Those are still phalanges, okay? Even if they are a little funky because people's toes are gross, right? They're still phalanges. And these are metatarsals instead of metacarpals, all right? Which makes these tarsal bones instead of carpal bones. So now we have tarsals. All right, like a child. But those are tarsal bones now. Do you see those? Yeah. Let's go to these. You saw these on the upper extremity there. You should know what those are. They form in tendons at points of stress, sesamoid bones, okay? You have 2 of those on the first metatarsal as well. What else do I want to know? So again, the joints also matter. All these joints are the same, right? We have our intertarsal joints, and then tarsal, metatarsal phalangeal. MTP, then we have our hip, right, and our dip, just like we did before. Same naming conventions, except this time instead of lateral to medial, it's medial to lateral. Okay? That's the rundown on those. All right, let's go and give you a good view so you can really see these tarsal lines. There you go. All right, so this is not near as interesting of a mnemonic device as the upper extremity, but it's the one I know, and if you can come up with one, use it. People get creative. But it is come to Colorado the next 3 Christmases. All right? So back here, you have your heel, which is your calcaneus, and then articulating with the distal tib-fib is the talus. So come to Colorado. It's going to be your cuboid is the Colorado. Then your navicular. Next, and then 3 Christmases. You have 3 cuneiforms. Medial, intermediate, and lateral. Okay? So that probably makes a ton of sense, right? You've got those ready to test. Let me go to a different image. Let's go to an oblique. You can see them a little differently here. Again, calcaneus, come. The talus is up here. 2, cuboid is Colorado. Next, 3 Christmases. Okay? Calcaneus, talus, cuboid, navicular, lateral, intermediate, medial cuneiforms. Okay? So those are your tarsal bones. There are 7 of those, by the way. Or, I'm sorry, 8 of those as well. Let's look at the calcaneus specifically. We'll go to a lateral. I want to break down a couple things on this bone. This is a good one. All right, this is a pediatric patient as indicated by the line here. the growth plate. Alright, so this is the calcaneal tuberosity here. The Achilles comes down and attaches right down here. You can almost see that. But anyway, that's the calcaneal tuberosity. And then there's another thing I want you to see. It's a little shelf right here. It's called the sustentaculum tali. It's one of my favorite structures. You gotta know it. Sustentaculum tali. Another very important structure you have to recognize is this. It is the tuberosity of the fifth metatarsal. That is an attachment site and a common site of avulsion fractures. The avulsion fracture that occurs here at the fifth metatarsal, the tuberosity of the fifth metatarsal, is the Jones fracture. So when that breaks, that's a Jones fracture. Okay? Tuberosity of the fifth metatarsal, and then you'll have another good look here. This space here, that is called the sinus tarsi. You've got to know that. Okay? Let's see. So again, these are very quick reviews of these structures, but I'm just trying to point them out for you so that you can take it, you can have some resource for that. All right? We'll do a tib fib here, or an ankle, and we'll look at the distal tib fib. All right. So on these, the structures I want you to know are the malleoli. The fibula is lateral, right? So this is going to be your lateral malleolus, medial malleolus. Posteriorly, you can kind of see it back there. Some people call that the posterior malleolus. So like some people have a fracture here, here, and here, and they call it trimalleolar, a trimalleolar fracture. So anyway. Let's see, there is an anterior tubercle, but I'll show you that on the bones. We can't really get to it here. So this is the distal part. That's really, these are what you gotta know here. We have our talus. This is the best picture of the talus. And this is gonna be the talar domes. When you look at it on a lateral, it's gonna look like a rounded dome. And this articulates to form this joint, which is the Mortise joint. And when we do a partial oblique medially, that opens right up. It's beautiful. So we have our distal fibula, distal tibia, talus, and the rest of these you really can't make out, okay? So we'll go to a tib fib so we can get to those other structures. You see what I meant about the dome, though, real quick? I'll pause. Talar dome, navicular, so on and so forth. You gotta be able to label those. Again, here's the sustentaculum tali, and right behind it, there's the sinus tarsi. All right, let's get to the rest of the fib. All right. So other anatomic features here. As we move proximally, we get to the intercondylar eminence, which exists on the knee. That is here. These two little points, those are your intercondylar eminence. Under here is the intercondylar fossa. So oftentimes, like we see with other structures, when there is a protuberance of some sort, a bony protuberance, there's also some type of fossa on the opposing bone waiting to accept it, right? It's common. So if you're ever like, oh, where's the fossa? Just look for what it's named after, if you know one of the structures at least. These are going to be your tibial condyles, and these are your the medial and lateral condyles on the knee, or the distal femur. Okay. Let's see. On your fibula, you have the head of the fibula, which sits on an AP. It's partially superimposed by the tibia. Okay, so it sits kind of back and behind the tibia. So that's it's hard to see on this one, but that's where it's at, I promise. And then the other thing, the last structure I really want you to see on the X-rays is tibial tuberosity. You see that on the lateral rib. There it is. So if any of you have heard of Osgood Schlatters, it's a chronic avulsion fracture, or ripping away of this bone. So tibia comes down and the tuberosity is like this, right? When you're younger, there's still like a line, like we saw in that calcaneus. There's still a line there. It's not fully fused. So when you're younger, the patellar ligament anchors the quadriceps muscle to your tibia at the site of the tibial tuberosity. So if it's a running injury, right? So constantly running, these massive quadricep muscles are pulling that bone off, that little piece off, and then it heals, and then it pulls off, and then it heals. And so they're like partial chronic avulsion fractures of the tibial tuberosity. Very uncomfortable. Right? Alright, that's tibial tuberosity. We talked about the condyles, and then the joints we'll get into a little more in lecture when we come to the ankle. Alright, so we're going to move over now to these structures as we look at them on the table here. We'll start with a foot. Let's see if what happened? Let's try to get it toes up, so let's do that for this one. This is how the x-rays usually look, so it'll be better to look at it this way. Alright, so again, we'll talk through these bones. Make sure you can see them all right. All right. Again, we have our phalanges here. All right. And we'll have our metatarsals here. Again, the metatarsals have a base and a head, so do the phalanges, base and a head. All right. Another outstanding feature of the metatarsals is right here laterally, there is the fifth metatarsal, or the tuberosity of the fifth metatarsal. It's an attachment site for structures, and it is a common site of a avulsion fracture, which is a Jones fracture, right? And then the joints follow the same convention as the naming of joints for the hand, right? We have intertarsal articulations. We have tarso-metatarsal articulations. We have metatarsal phalangeal articulations here at that juncture. And then we have our interphalangeals, proximal and distal, and then we have our ip. Okay? So those are all follow the same stuff. Again, you label these opposite from the hand. So it's still like thumb side, except the thumb is medial on the foot. So 1, 2, so on and so forth. Okay, and now let's talk about the tarsal bones. There are 8 of them. Let's get a good projection here where we can see them. We have our calcaneus, which is our heel, right? That's our heel. We have our talus, which articulates with our tibia and our fibula here. Okay. Then we have our cuboid, which really does resemble a cube. Looks like a cube. We have our navicular, which looks like a half moon. And then we have our cuneiforms. This is our lateral, our intermediate, and then our medial. Remember, the big toe is the medial side. Okay? So that's that part of the foot anatomically. Let's look at a couple other structures here. Let's see. The sustentaculum is a medial structure. Well, what's going on, right? I promise I'll show you. All right. So you see that shelf? It's very obvious here, right there. This shelf, sustentaculum tali. Okay? Roll this way, or this way here, and you're going to get a gap right in here. See that hole? Like that? That's sinus tarsi. Okay? Spending time manipulating this and discovering what the anatomy looks like 3D is going to be very helpful when you go to label a lateral ankle, trying to identify what that is. When you look at it here, you can tell it's the cuboid, but that's because you can move it, right? You can come back and say, oh yeah, that's obviously the cuboid, but it's hard to tell that like this, and it's very hard to tell that on the radiograph when you don't have accurate 3D models. You can see the sesamoids really well here, just poking out right there. What else we got? And that's most of that. Let's look at the ankle, like we might on an X-ray here. Forgive me playing with the table. There we are. Alright, so this is about what an ankle is going to look like. An AP is going to look like this. But you'll have your distal fibula superimposed over the distal tibia, right? They overlap right here, which is fine. That's how it's supposed to be on an AP. Again, this is our talus, right? And these are tibiotalar, and then fibulotalar, fibiotibular, and all those fun names of the joints, right? Recognizing that it's just the composition of the two bones, and the names kind of go together that way. All right. So we do a medial oblique. That's what I was telling you, right? So when we do that, 15 to 20 degrees medial, notice how this part of the joint opens up, this opens, and this opens. That look, that's called the mortise joint, and it's a specific projection, okay? So recognize that. Let's see. The anterior tubercle of the tibia is what superimposes the fibula on the AP. It's right here. This is the anterior tubercle of the tibia. Let's see if we can. And again, what they often call the posterior malleolus, you can see that right here. So when all of those fracture, they call it a trimalleolar fracture. And again, this is going to be right here. That's your medial malleolus, and that's your lateral malleolus. What do we got here? What else? Do talar domes again. Like if the fibula wasn't there, you'd see a nice rounded dome. Talus. All right, so let's look at the proximal. We're lateral already, so let's take a look. So if you remember, typically have an attachment here, tibial tuberosity. Gotta know it. So it's really awkward the way these come up, so just forgive me for a sec. Okay. You should be able to see that pretty well. The head of the fibula is here. And on your typical AP, when everything's square, it sits behind the tibia, okay? You don't really see it clearly. Just kind of pokes out a little bit. These are tibial condyles. This is your tibial plateau right here. It's just the tibial plateau. And there's the eminences are not very prominent here, but those are your intercondylar eminences right there. And then right here is your intercondylar fossa. These are the epicondyles, these are the condyles of the knee. We have our lateral condyle, medial condyle, so articulating surfaces of the knee. And typically you have an ACL and a PCL that cross in here, and then some meniscuses that fill in the sides to cushion the joint. This is your patella. The apex is inferior. The apex is inferior, the base is superior, so it's backwards. All right. Let's see what else we got here. This is the patellofemoral space, right there. And that's about all I need you to know on lower extremity 1.